Welcome to the deep dive. Usually when you hear the phrase anti-aging or tissue restoration, you probably picture something happening like right on the surface.
Right, yeah, like smoothing out a fine line.
Exactly. Or, rubbing some hydrating serum onto dry skin. It feels like a very passive, quiet, almost artistic process.
People definitely think of it as just painting over a canvas,
Yeah.
but biologically speaking, when you get down to the cellular level, it's anything but quiet. It is incredibly violent.
And that's exactly what we're getting into today, because when you actually look at what is happening beneath the skin, especially when medical professionals, introduce engineered gels into the body to restore lost volume, you realize it's not a canvas at all.
No, not even
It's
close.
an absolute battlefield. There is a microscopic war happening right under the surface between advanced bioengineered polymers and your body's natural demolition enzymes.
And, nowhere is that war more intense, more physically demanding, or just more complex than in the highly specialized tissues of the female body.
Which brings us to our mission for today. For everyone listening, we are taking a deep dive into a very specific, incredibly fascinating biomechanical question. What is the impact of our native tissue hyaluronidase breakdown rates on the longevity of HA, that's hyaluronic acid fillers, when they are injected into the outer labial skin? We want to know how these gels survive the body's natural defenses.
Yeah, because we are looking at a space where menopause, aggressive enzymology, and advanced polymer chemistry all just crash into each other in a highly dynamic, high-stress tissue environment.
Right. And to get you the best insights on this, we've pulled from a really fantastic stack of sources. We're looking at comprehensive vulvovaginal dermatological atlases, specific clinical filler protocols, including the recent Esalane study, and some incredibly dense, detailed biochemical papers on HA rheology and enzymatic degradation.
And the reason we need all those different perspectives is that we aren't just talking about aesthetics here. This is about deep functional restoration.
Yeah.
To understand how these injected fillers survive, we first have to understand the extreme environment they're being dropped into, because the brutal biology of this tissue dictates the heavy-duty chemistry required to survive it.
Okay, I want to start right there. Before we even talk about the fillers or the enzymes trying to eat them, we need to understand the battlefield itself. We're talking about the outer labia, the labia majora. What makes this tissue so unique?
Well, from a developmental standpoint, the vulvovaginal epithelium is wildly unique. It's the only area in the female body derived from all three embryological layers, meeting in close proximity.
Wow, okay.
But for our focus today, the outer labia, we're looking at tissue derived specifically from the ectoderm.
So if it's from the ectoderm, it's essentially just skin, right? Not mucosal tissue like the inside.
Correct. Technically, it is keratinized, stratified, squamous epithelium.
Whoa, hold on. I'm going to need a translation for that.
Fair enough. It basically means it's a toughened, multi-layered, waterproof outer skin. It has hair follicles, sebaceous glands that produce heavy oils, and eccrine and apocrine sweat glands.
So it's built to take a beating.
Exactly. It is a rugged, highly functional protective cover. From an evolutionary standpoint, its primary job is to act as a physical shield. It protects the delicate inner tissues, the labia minora and the introitus, from constant mechanical friction.
Like the friction you would get from just everyday movement.
Right.
Walking, wearing tight clothes, or doing high-impact sports like horseback riding or bicycling.
Yes, exactly. It's a high-stress, high-impact area subject to continuous shear forces. Every time you move, that tissue is stretching, compressing, and rubbing.
Right.
But to do its job effectively without tearing, this tissue needs volume and elasticity. And those two properties are heavily, heavily dependent on estrogen.
Because estrogen is like the boss that tells the cells what to do.
Put simply, yes. Estrogen constantly signals the local fibroblasts, the builder cells in the tissue, to produce hyaluronic acid. And hyaluronic acid, or HA, is a sugar molecule that acts like a massive sponge. It binds water, keeping the tissue plump, elastic, and highly protective.
I think a good way for you listening to visualize this is to think of the labia majora like the body's natural shock absorbers on a car.
Oh, that's a great analogy.
Yeah. When you're young and estrogen levels are high, the factory is fully staffed. It's constantly making replacement parts, pumping out HA, and keeping those shock absorbers full and bouncy. You can drive over any bump, no problem.
Right, and taking that shock absorber idea further, when those deflate, it's not just a cosmetic issue. The actual chassis of the car starts taking damage.
Oh, wow.
And that is exactly what happens with age and menopause. Estrogen levels plummet. The factory just shuts
The
down.
builder cells go to sleep.
Yes. The subcutaneous fat begins to diminish, and that vital HA synthesis completely crashes. Clinically, we call this hypertrophy, which is a severe loss of volume.
The shock absorbers deflate.
Exactly. And without that protected cushion, the friction we talked about earlier suddenly becomes destructive. It leads to chronic vulvitis, extreme dryness, and pain, particularly intromission dyspareunia, which is severe pain during sexual intercourse.
That sounds awful.
It is. It has profound functional, psychological, and sexual consequences for the patient.
So the factory stops making the HA that keeps the shock absorbers inflated. That seems bad enough on its own. But if I'm reading these biochemical papers right, here's where it gets really tragic.
Yeah.
It's not just that the body stops making new hyaluronic acid, it's that the body is actively, aggressively destroying whatever tiny amount is left. Let's talk about the demolition crew.
The demolition crew is a family of naturally occurring enzymes called hyaluronidases.
Okay.
In humans, there are 6 different hyaluronidase-like genes, but the main ones creating havoc here are HYL1 and HYL2. HYL1 is the primary degrader floating around in the extracellular matrix, while HYL2 operates right on the surface of the cells.
And their entire reason for existing is to just hunt down hyaluronic acid and chop it to pieces.
They act exactly like molecular scissors. Native hyaluronic acid is a long, repeating polymer chain made of alternating sugar molecules. The hyaluronidase enzyme specifically targets and cleaves what we call the beta-1,4-glycosidic linkage.
Right.
This is the bond connecting N-acetylglucosamine and glucuronic acid.
Okay, beta-1,1,4-glycosidic linkage is a bit of a mouthful. Let's break that down for the listener.
Sure, think of a hyaluronic acid chain like a long string of Lego blocks, alternating between a red block and a blue block, over and over.
Okay, I'm picturing it.
The beta-1,4 linkage is a specific plastic snap connecting the red to the blue. The hyaluronidase enzyme is a specialized tool designed to fit perfectly over that specific snap and pop it apart.
Got it. So because our tissues are full of these highly specialized molecular scissors, natural hyaluronic acid in our bodies actually has a shockingly short lifespan.
It is incredibly brief. The half-life of native HA in human tissue is just 2 to 3 minutes.
Minutes. Wait, not days.
Minutes. Our subcutaneous tissues are absolutely teeming with these enzymes, about 2 to 5 international units of hyaluronidase per gram of tissue.
That is insane.
It is. Almost immediately after HA is produced, those enzymes start snipping the long chains into tiny, microscopic fragments under 400 Daltons.
Meaning they're chopped into pieces so unimaginably small that the body just flushes them away.
Yes, a Dalton is just a tiny unit of atomic mass. Once the HA is chopped under 400 Daltons, it has zero structural integrity. It is simply washed away by your natural interstitial fluid right into the lymphatic system.
Wait, let me unpack this because I want to make sure I have the timeline right. Just as a woman hits menopause and desperately needs HA to maintain tissue hydration and protect against daily friction, her body stops making it.
Right.
But these demolition enzymes, these molecular scissors, are still there, frantically chopping up whatever is left. It's a double whammy.
It is worse than a double whammy, actually. It's an acceleration. Yeah. Under normal premenopausal conditions, estrogen actually acts to suppress hyaluronidase expression. Estrogen keeps the demolition crew in check, making sure they don't destroy too much HA too fast.
Oh, no.
Yes. So when estrogen plummets during menopause, the brakes come off. Hyaluronidase activity doesn't just stay the same, it spikes.
So the destruction speeds up right at the exact moment the production stops.
Precisely. Furthermore, the sources note that any systemic inflammation or UV exposure also acts as a multiplier, further spiking this enzyme's destructive activity.
Wow. So the labial tissue during menopause is practically flooded with these aggressive HA-eating enzymes running completely unchecked.
Completely unchecked.
Which finally brings us to the core tension of our deep dive. If a doctor wants to restore that lost volume, to reinflate those shock absorbers by injecting a syringe of HA filler, how on earth does that filler survive? If native HA is destroyed in 2 minutes, why doesn't the injected HA just vanish while the patient is still sitting in the clinic?
That right there is the multi-million-dollar question in polymer chemistry. The answer is chemical modification. We have to alter the hyaluronic acid so the enzymes can't easily break it apart. This process is called cross-linking.
I found the details on this manufacturing process absolutely fascinating. How do they actually build this defense mechanism?
Well, it starts in a laboratory reaction vessel. Manufacturers take the raw natural hyaluronic acid chains and heat them to about 40 to 50 degrees Celsius. Then they spike the pH all the way up to 11.5, making it a highly alkaline soup.
Why the heat and the high pH? What does that do?
It prepares the HA chains chemically. The alkaline environment causes the chains to uncoil and makes their oxygen atoms highly reactive, ready to accept a cross-linking agent.
Okay.
The most common agent we use is called BDDE. When BDDE is pumped into this heated alkaline mixture, the ends of the BDE molecule will split open and bind tightly to two different hyaluronic acid chains, bridging them together.
And for my notes, the connections it creates are massive. They form these things called ether bonds, which have a bond energy of 340 kilojoules per mole. Now, I'm not a chemist, but 340 kilojoules sounds like a lot of energy required to break them.
It is an immensely stable chemical bridge. What happens is that these initially scattered free-floating strings of HA are suddenly anchored together in three-dimensional space. The liquid transforms into a highly structured, cohesive gel.
Okay, so earlier I was picturing this process like we were forging little suits of armor for the HA molecules, but reading about how this 3D net forms, the internal pores, the empty spaces inside the gel are compressed down to just 50 to 100 nanometers wide. So it's less like armor and more like a microscopic chain link fence,
That's
right?
a much better way to visualize it. It's a matter of pure physical scaling. The hyaluronidase enzyme, our molecular scissors, has a physical diameter of about 65 nanometers.
Oh, so if the pores of the gel are only 50 nanometers wide, the 65 nanometer enzyme physically cannot squeeze through the fence.
Exactly. They are locked out of the core of the gel. They can't get inside to chop it up from the inside out.
That's brilliant.
Yeah, so they're forced to just sit on the outside surface of the filler and slowly gnaw away at the outer layer. Because they can't penetrate the chain link fence, their efficiency drops to near zero. Instead of destroying the HA in minutes, the enzymes can only erode the surface at a rate of roughly 0.05 millimeters per week.
That is incredible. By building this chemical chain link fence, we take a material that naturally lasts a couple of minutes and forcefully extend its lifespan to over 9 to 12 months.
Yeah,
But that makes me wonder if the chain link fence is what stops the enzymes, and the more you cross-link it with that BDDE stuff, the tighter the fence gets. Why stop there? Why don't we just cross-link it to 20% or 30%, make the fence totally solid, and make the filler last forever?
that is the exact temptation early polymer chemists faced. But it runs into a biological brick wall we call the Goldilocks rule of cross-linking. The degree of cross-linking has to be strictly maintained between 1% and 10%.
What happens if it's too low?
If it drops below 1%, the gel is too weak. The fence is too loose, the enzymes get in, and it flattens out in a matter of days. But if you push that cross-linking above 10%,
The fence gets too tight.
yes. If cross-linking exceeds 10%, the pores shrink to under 50 nanometers. The skeletal structure becomes so dense, rigid, and tightly packed that water molecules can no longer easily penetrate it.
And water is the whole point.
Right. Remember, the whole point of HA is to bind water to hydrate the tissue.
Yeah.
But it gets much worse. Because it has been so heavily modified with chemicals, your body's immune system no longer recognizes it as hyaluronic acid.
It stops looking like sugar and starts looking like plastic.
Precisely. The immune system perceives it as a foreign invader. White blood cells, specifically macrophages, will rush into the area, secrete powerful lysozymes and reactive oxygen species, and completely destroy the heavily armored implant within 72 hours.
That is a wild catch-22. So you have to disguise the fence perfectly. It has to be tight enough to keep the molecular scissors out, but it still has to look natural enough that the immune system's heavy artillery doesn't realize it's been engineered.
It is a brilliant molecular balancing act. And achieving that exact balance between 1% and 10% cross-linking is what allows these specific gynecological fillers to perform so well.
Which brings us to how this actually plays out in a real patient. Because we have this perfectly balanced gel in a syringe, but then a doctor has to put it into the labia majora. And as we established, a woman goes horseback riding, she goes running, she sits at a desk for 8 hours. Doesn't the physical crushing force of the body just tear this gel apart?
It absolutely tries to. The sheer mechanical friction we discussed earlier is a major threat. When the surrounding muscles and tissues are constantly contracting and pulling, those sheer forces stretch and compress the filler. Our sources note that this constant squeezing can cause something called lamellar flaking.
Wait, flaking, like an onion peeling apart under pressure.
That is exactly what it looks like microscopically. The gel gets compressed so thinly by the body's weight or movement that the outer edges begin to flake apart in layers.
But if it flakes apart, doesn't that create more surface area?
It does. And remember, the hyaluronidase enzymes are stuck on the outside, gnawing away at the surface.
Right.
So if you increase the surface area by peeling the onion, you give the enzymes much more room to attack, which speeds up the degradation of the filler.
So the body is physically breaking the fence apart so the enzymes can rush in. But despite all of that, the enzymes, the friction, the flaking, the clinical data is actually incredibly positive. I was reading through the Esalane protocol in our sources. How do they inject this so it actually survives?
The Esalane study is a fantastic benchmark. It requires meticulous technique to give the gel the best chance of survival. The clinician uses an 18-gauge blunt cannula to inject the filler
Why a blunt cannula instead of a sharp needle?
to prevent vascular occlusion. The labial tissue has a rich blood supply. A sharp needle can easily pierce a blood vessel, and if you accidentally inject this dense, thick gel into a vein, you can block blood flow and cause tissue death.
Yikes.
Yeah. A blunt cannula pushes blood vessels safely out of the way without piercing them.
That is terrifying, but makes total sense why they use blunt instruments.
They lay down the HA in a slow, linear retrograde pass. They inject up to roughly 2 milliliters of this specifically formulated HA per labium, placing it deeply into the superficial or deep dermis.
Okay.
And because of those incredibly strong 340 kilojoule per mole ether bonds we discussed earlier, the gel holds its ground.
So the chemical bonds are strong enough to resist the physical crushing.
Mostly, yes. Those ether bonds are able to deflect about 85% of the physical tearing forces generated by the body's movement. They resist the lamellar flaking enough that the filler survives the hyaluronidase siege for a remarkable 9 to 18 months, depending on the patient's individual metabolism.
So bringing this all together for you listening, what does this actually mean for the patient? It means the filler isn't just a passive implant taking up space like a silicone implant. By holding off those molecular scissors for 12 months, the HA acts like a deeply hydrating sponge inside the tissue.
Exactly.
And the craziest part of the data is that it actually biostimulates the local fibroblasts. It tricks the aging labial tissue into waking back up and regenerating its own natural collagen.
That right there is the crux of why this matters. Understanding this intricate biomechanical dance, the enzymes, the chain link, cross-linking, the shear forces, it helps us realize that in this context, medical aesthetics is not just cosmetic. It is highly precise functional restoration.
We really are talking about rebuilding the shock absorber so the car can drive again.
Exactly. Restoring the labia majora with these engineered gels dramatically improves a woman's quality of life. It restores the anatomical barrier that protects the inner tissues against chronic infections and painful friction.
Yeah.
It relieves the pain of intramission dyspareunia, restoring sexual function and psychological well-being. And it does all of this using a biocompatible material, without the painful downtime or permanence of invasive surgery.
It is an incredible triumph of chemistry over a very hostile, aggressive biological environment. But before we wrap up today, I want to leave you with one final, slightly provocative thought to ponder. Earlier, we mentioned that systemic inflammation directly increases hyaluronidase activity.
Right.
Inflammation acts like a hyperdrive for those molecular scissors, causing fillers to break down much faster than normal.
That is a very well-documented biochemical pathway, yes.
Yeah.
Inflammation accelerates the destruction.
So could tracking how fast a patient's filler dissolves actually serve as an early warning biomarker? Think about it. If your perfectly engineered 12-month filler mysteriously vanishes in just 3 months, could that accelerated breakdown be your body's hidden alarm bell?
Well, that's interesting.
Right. Could your filler dissolving too fast be the first sign of an undiagnosed inflammatory or autoimmune disease long before any other symptoms appear?
That is a brilliant frontier to consider. As our fillers become more advanced, our ability to read how the body interacts with them, how aggressively the body attacks them, might just become a new diagnostic tool in itself.
Just something to think about the next time you hear someone talking about dermal fillers. They aren't just cosmetic, they are complex chemical sensors, and the science inside our skin is always speaking if we just know how to listen. Thank you for joining us on this deep dive. Keep questioning the incredible science hidden inside our everyday biology, and we will catch you next time.